So we're delighted to be a part of this webinar. And Cassie, thank you for considering us and inviting us to be a part of this webinar. Um, for us, back to school is such an exciting and nostalgic season for families. Through education and preparation, our aim with this webinar is to help families continue to enjoy the happiest of times. My favorite back to school memory for my child, she's an adult now, but when she was a child with epilepsy, was a fresh start to a fresh school year with new school supplies, new school clothes, and meeting the new teacher. Those were always the most exciting days for back to school. So we're going to get started with this webinar now, and you're going to hear from so many wonderful speakers. And our first speaker is Dr. Melinda Schneider from Children's Hospital Orange County. Dr. Schneider is a pediatric epilepsy fellow, and we are so very thankful she has partnered with us to share her expertise and vast experience with us. Welcome, Dr. Schneider, and may I ask you to share, starting out, to share your favorite starting of the school year experience?
Absolutely. Thank you, Jana, for introducing me, and thanks to all the team that put a lot of hard work into this session and everyone who's here tonight. So I met my best childhood friend in first grade, and I was so excited to find out a couple days before school started that my best friend Allison was in my second grade class, and we are still friends to this day. We talk almost every day, and so 20 something years later, it's definitely one of those warm and fuzzy feelings to have a good friend in class and grow up together. So I'm going to start sharing my screen. Looks like I just need to be enabled from the host. Cassie, could you just enable screen sharing for me? Okay, let's try this. Perfect. So like Jana said, my name is Dr. Melinda Schneider. I'm a pediatric epilepsy fellow at Rady Children's of Orange County, recently renamed from CHALK. I did my residency training at UC San Francisco in child neurology, which is a 5-year residency training program. And then prior to that, I was actually at UC Irvine for medical school and UC San Diego prior to that for undergrad and master's. So I'm a long-term Southern Californian, but actually grew up in Northern California as well. But fell in love with child neurology down in Southern California, and I'm just enjoying sort of getting my career started and obtaining a lot of training. And my heart is in advocacy for kids and for parents navigating what can be a really challenging time in childhood with a new diagnosis of epilepsy. So I'm really thrilled to be invited to speak. So today, my goal is to spend, about 20 minutes to talk about some very common issues that will arise for patients that are starting school. And we're going to talk about some co-occurring conditions that come up as kids start to be required to focus more. Their brains are asked to do more and more with each grade. How you as a family can work with your school nurse. They're a big ally for families. Briefly touch on action plans and emergency meds, talk about a lot of the psychosocial comorbidities of epilepsy and what to do about those, and if you see them in your child. We'll touch briefly on how to engage your community in trainings and advocacy there with seizure recognition and first aid. And then end with some discussion around transitions of care if you have a child who's approaching sort of adulthood. And talk about multidisciplinary care that you can access in your community and what a level 4 epilepsy center can offer your family. So just to get us started here, school is so much more than just the academics, the math problems, the essays that they have to write. Kids are learning skills about social interactions and building friendships. Attendance becomes more and more important, and self-esteem grows and confidence grows during this time period throughout sort of K through 12 education. And so epilepsy can sometimes interfere with that. And so while we spend a lot of time and effort thinking about academic performance with school, I think equally important is to balance this discussion and support around all of the other skills that a child in school is trying to build and gain. And so epilepsy definitely can lead to missed school, can have some associations with mood changes, anxiety, and depression. and maybe even social interactions and friendships. So we're going to talk more about how to navigate this as both a child and a family. But first, I want to remind you that there are a ton of resources. Schools have support systems at every level, and they really want to help. So it can be a complex system, and it's up to families to really find that support, whether it's through someone at school or through their healthcare team, or even somebody out in the community, like through one of your alliance organizations. But partnership is the name of the game here. Working with your team and figuring out who that team is going to be one of the best ways to really support your whole child. Individualized education plans and 504 plans, if you're not familiar with, are actually federal laws to ensure that children get access to the education support that they need, regardless of sort of their ability to participate or perform. And so this is a whole nother, presentation that we could talk about, but you should know that these are protected and you have access to these through your school to be able to individualize how your child receives education at school or through homeschool programs, as well as they should be able to have access to medications or alternative access to resources or extra time, etc., as needed. One tip, I wanted to make this really practical, so I have some sticky notes on here of things that I'd love for you to take away, is, at every school, there's going to be a different system and a different advocate. And so talking to parents who are maybe just a couple grades ahead or a little bit ahead of you and your child can be a really great way to figure out who is the advocate at your school to connect with and to start building that team for your child. Sometimes it's the school nurse, other times it's a counselor or a principal or maybe even a teacher. So thinking broadly about it. So let's talk about school nurses because this is really in their wheelhouse. Epilepsy at school can be a medical health condition that they need to manage at school. We never know when a seizure may happen, and kids spend 8 hours a day at school, and that's a third of their life in the early stages of their epilepsy. And so it may be that your child needs to navigate a seizure at school, and the school nurse should be your point person. They're also there for emergencies. They can help with administration of medication if your child needs a medicine dose during school hours. And they should be able to sort of bridge the gap between school and medical system. This is, a bit simplified, and I recognize that this is a huge challenge and something I'm working on, that the school to medical pipeline communication can be challenging, but I would encourage you to talk to your school nurse and sign release forms so that we can have a better pipeline of communication from doctor's offices to the school if you feel that's appropriate or would help you, your child, and family. One tip is to schedule an in-person meeting. Introduce yourself and your family to the school nurse, or maybe just through Zoom if that fits better with your schedule, so that you can have a face to the name with the school nurse who's going to be interacting with your child. And maybe during that meeting, you bring some of the resources like your Child Seizure Action Plan, which you've likely already provided to the school, but bring another copy, make sure it's in hand so you can talk through it. And emphasize when you want to be hearing from the school should a seizure arise or should other issues arise. And EAA and also the Epilepsy Support Network of Orange County have some great resources to help educate your school if the school nurses are less familiar with dealing with epilepsy at school. So let's talk seizure action plan for a little moment here. Again, this is a whole topic in and of itself, but I want to bring your attention to there are forms that are easily accessible online, and your doctors and your epilepsy or neurologist doctors should be able to provide you with an updated seizure action plan for every school year. It's required by most schools. So this is really sort of a 1, 2, 3 step for what should we do if your child has a breakthrough seizure at school? How do we keep them safe? What is the first aid that you'd like to be administered? Who should be notified? And is there a medicine that we should be giving your child if the seizure happens at school? One tip that I love is make sure that the copies are with anyone that the child spends time with, including bus driver if they take the school bus, nurses, as well as in the classroom where the child is. So teachers should have a copy as well. Many schools just have a copy of this in the school nurse's office, but again, you're sort of in charge of your child's care, and being an advocate as a parent can make a world of difference. Another point that I want to emphasize is just in the last few months, actually, we have access to more um, like kinder rescue medication administration avenues, meaning most children, when they're under the age of 2, get a medication administered through their bottom, a rectal diazepam. However, now for kids that are in school age, there's medications that can be administered through a spray through the nose. Valtoco has been approved to a much lower age group as well as Nasolan. So you should talk with your doctor about the possibility of switching the rescue medication to an intranasal option to avoid embarrassment should your child need medication when they're around their peers. Okay. So, say your school isn't super familiar or comfortable with treating seizures or even recognizing seizures at school. I want to point you to tons of resources through EAA and also Support Network of Orange County to obtain training for your community. And this can really make a difference for a child who has a seizure where otherwise it wouldn't have been recognized potentially, or potentially could be in a dangerous situation. And really promotes this understanding of what is epilepsy and how does it impact school sort of across our community. So if you're finding that the people you're talking with at the school aren't getting it for whatever reason, or you just want to add some additional support to their foundational knowledge, please reach out to our partner organizations and we can get some training into that school or that community support group. All right, so let's talk about some of the co-occurring conditions that we see in school-aged children. One of the biggest ones that I talk with my patients about is ADHD, or attention deficit disorder and hyperactivity. And this can really impact learning. And this can be developed, in elementary school, middle school, or even high school, so across the age groups. And 1 in 3 to 4 children with epilepsy will develop this. It's important to recognize this because there are things we can do about it. We can collaborate with special education if that's what's needed, or create a new IEP plan or 504 plan. We can also provide medication if that's what's indicated from a medical perspective. And then school attendance is another big issue with recurrent seizures. If a child is having a lot of breakthrough seizures, especially when they get ill, they're often missing a lot of school. And schools, they get their money often if they're in public school from attendance. And so schools get kind of upset when kids start missing school. And so if they're not understanding why your child is missing so much school because of their seizures, it can lead to some friction. So just staying in early communication with your school and teachers is going to make this process much smoother. And your doctors or medical team can also help facilitate this if needed. And finally, sleep. Sleep is such a big deal. As children are growing, there's hormones and memories that are being formed and released, and it's so important to overall health and learning, memory, etc. But it can be often disrupted in children with epilepsy. Either they're having seizures at night that are going unrecognized, or they're not sleeping well because of some comorbid anxiety. Also, medications can make daytime sleepiness much worse. And so then if children are falling asleep in class, they're not learning as well, and they're not doing all of the things that we hope they are gaining from school. So paying attention to sleep and talking with your healthcare providers about sleep is super important. One tip is routines. Children thrive on routines, especially keeping a consistent bedtime and wake up time, even on the weekends. I know it's hard, but can make a world of difference for children who struggle with sleep. And so we can talk more about sleep hygiene if that's an interest. But routines can be really helpful for a lot of the comorbidities associated with epilepsy. Okay. Depression and anxiety is really, really common in children and adults who experience epilepsy. But the good news is that it's really highly treatable with either medication and or psychological therapies. And it's one of the most common reasons that we see kids missing school or not performing well in school. And it's a serious disorder. Up to 20% of children who experience depression will also experience suicidal ideation. And so I want you to be thinking about this and screening your child for this. If you're noticing things, bringing it to the attention of someone in your community. Schools have resources. Your pediatrician and also your neurologist want to hear about this if this is something you're noticing in your child. Some signs to look out for are social withdrawal or loss of interest in things that they previously enjoyed doing. Sleep changes, either too much or too little, can go either way. And also appetite changes, either increased or decreased appetite. Um, and finally, for anxiety, children manifest anxiety differently than adults do. And often we'll see lots of somatic symptoms like frequent tummy aches or headaches, and especially these kind of symptoms that are leading to school avoidance should be addressed and evaluated for possible anxiety disorder. You can imagine that having seizure disorder and potentially worrying about when the next seizure is going to happen can be really taxing on kids' minds, especially if you're worried about having a seizure in front of your peers, or worried about your own personal safety should another seizure happen. So it makes total sense that a child would be worried about this, and this should be something that you're discussing often with your care providers and also with the school. So open conversations are the best thing that families can do to try to keep this pipeline open communication. And this can be challenging, right? This is an easy topic to talk about. So I have a couple of tips. I've just noticed, and the evidence suggests that talking with your child while doing a shared activity can make the conversation so much easier. So maybe you're going for a walk or driving to an after school activity, or doing a craft project together. That could be a good time to start modeling your own honest discussion about your well-being, your feelings, and some healthy coping strategies that you're thinking about, and having an honest conversation with your child if you have some concerns, or just to check in with them and see how they're doing. Stigma. This is like one of the bane of my existence as a pediatric epileptologist. There is so much misunderstanding and fear around children and adults who experience epilepsy. And this can lead to a lot of misunderstanding and a lot of isolation. There's sort of many levels, and I could talk all day to you about this, but there are many levels that people who have experienced stigma can experience it at. So one, there's enacted stigma, meaning that what the community or what the people surrounding you know about your condition may lead them to treat you in a different way, and lead to their behavior causing you to feel stigma. There's felt stigma, where internally the person who experiences epilepsy knows about the community stigma and stigmatizes themselves, or has some really negative beliefs about their epilepsy or their disorder. And then there's structural stigma, and we're seeing this at the highest level of our government, but there are rules and laws and regulations that trickle down and affect the individual, that lead to a felt experience of stigma. And so the impacts are broad. It leads to isolation, decreased confidence, embarrassment, there's mental health impacts, and it also leads to delayed treatment, delayed presentation to care, and limited and delayed access to assistance and supports. And even beyond the child, the family unit experiences shame, isolation, and worries about the future. And up to 51% of people with epilepsy experience some shade of gray of this. And so this is should not be normalized and should be continued to be discussed. And so your job is to continue to talk about it and be a peer educator and talk to the public, to help reduce this stigma and help provide some additional education and knowledge, so that we can work towards reducing these negative impacts. And I love to talk with kids about building their own self-advocacy. And I have a couple of tips for you to think about, to take action whenever you feel ready. So think about it, setting a time for your family to talk about what stigma means, and then brainstorm some actions that everyone could take to combat one stigma of epilepsy. So a couple of ideas to get started. We're in Epilepsy Awareness Month in September, so it's a great time to wear purple and then talk to people about why you're wearing purple and talk to them about epilepsy. Or potentially talk to 3 people in your community about your epilepsy experience if you're feeling ready to share your story. Or if you don't want to share your own story, Try teaching a neighbor or a family friend or someone in your community about a surprising epilepsy fact that you've recently learned. Okay, so now we're moving on to talk about kids who are getting a little bit older here. So I love this movie, 13 Going on 30. Sometimes it feels like our teens are in that world of they're going to be grown up so quickly. And the new school year is also a transition, right? So there's new teachers, there's new grades, and there's new expectations and new challenges as well. And so this is a great time to start thinking about what the transition to adult medical care may look like. And I cannot emphasize this enough that starting this discussion early makes a big difference. There's a lot that needs to happen to transition to adult neurology care. So this discussion hopefully is brought up by your neurologist around age 14 to 16 years of age, and talk with your doctors about a timeline and a plan. For kids who are more severely affected by their epilepsy, they're in California, conservatorship, meaning that the parents or guardians can continue to make medical decisions and other legal decisions for their child, needs to be in place by age 18 years of age. So starting this legal process early is encouraged as well. Um, Talk with your doctors because in some pediatric specialty groups, we'll see kids only up to a hard stop of age 18 years, but others will see children up until age 26 or young adults until age 26 once they've come off of their parents' insurance plan. And this is easier said than done, but if you start planning early, having a combined visit can be a really powerful way to transition care from a pediatric doctor to a new adult practitioner, either neurologist or primary care doctor. So setting up a time where both doctors can be present with you and your family can be a really powerful way to make sure nothing's lost in that transition. And then I always try to transition children and kids when their treatment and their seizures are stable and when their seizures are under control. They're not in and out of the emergency room and in and out of care, but they're overall doing pretty well. This isn't always possible, but this is the goal and this is what we strive for. So thinking about the timing of that is always important. So talk to your neurologist early. Ask them, what age do you transition your patients to adult neurology so that then you can plan ahead and you're not caught by surprise later. And then the last topic I wanted to touch on is thinking about college. So if you're thinking about college for your child, you may have a lot of worries about what epilepsy care may look like there. So it's always great to start early again and have these conversations with your child as well. Would you feel more comfortable at a small school or a large school, right? There's pluses and minuses to small school where there may be added supports or extra one-on-one attention. But then at a larger university, there's often huge opportunities for research and a breadth of areas of study and support as well. And then start talking about managing seizures independently. Does that need to happen with family, or does the young adult feel confident enough to start managing this while away from home? And then if planning to commute to college, reliable transportation and how a child or a young adult is going to get to school is really important. If a child or adult has a seizure, often we say no driving for a prolonged period of time. And so having a backup plan for how to get to college or school is going to be an important planning part of going to college. Thinking about and exploring accommodations that are available at college, connecting with the student healthcare center, and then also thinking about, are you going to have a roommate or not? And what does that look like? Will you tell your roommate about your epilepsy and potentially train them in how to help you should you have a seizure? Or does that feel too challenging and coming up with a different way to have somebody check in on you should you not show up to class? But all of these are really big questions to start thinking about early. And I'm really excited that we have a couple of lived experience stories to share with you as well in the upcoming segment of this session. So I'll let them touch on some of these topics that they surely thought about. So my take-home messages for you is you're not alone. There are supports at every level. Partnership with the school and your healthcare system is really the way that you're going to be able to provide the best school experience and also get the most learning and growth and development out of the school experience for your child. And I always encourage kids to take that next step in independence and find the confidence, speak out and share your experience if you feel comfortable, and advocate for yourself. Soon, in a few years, your child is going to be more independent than they were in the prior years, and so that growth and development is really important, especially around their epilepsy care and medical needs. So I just wanted to touch on there are centers. The center that I work for, Rady Children's of Orange County, previously known as CHOC, is a level 4 epilepsy center. And what that means is we are the highest level of care for epilepsy patients. We have a multidisciplinary team where we think about a lot of these aspects of the care of a child. We have neurosurgeons and psychologists, social workers, child life, specific EEG techs that know how to work with children, dietitians. There's neurology nurses that are specially trained in seizure management in the hospital, as well as nurse practitioners. And so really this is a place to go for the most advanced testing and the most advanced treatment. And so there are a level 4 epilepsy centers across the nation. So definitely reach out to your local partnership organization so that you can try to find a level 4 epilepsy center if you feel that the level of care for your child needs to be stepped up a notch. And with that, I just want to point you to some resources that are online. The Epilepsy Alliance of America and support network of OC you've already been introduced to, but they have some great resources on their website, as well as training that you can access for yourself or for your community. And then I also point you to the International League Against Epilepsy and also the Epilepsy Foundation that have a lot of really great educational resources to learn more about your epilepsy and all the comorbidities. And topics like this, like going back to school, or other topics that you're curious about as it relates to pediatric epilepsy and epilepsy through the lifespan. So with that, I want to thank the Epilepsy Alliance of America and also Support Network for allowing me the opportunity to chat with you all about my thoughts about returning to school with epilepsy, and pass the mic to our next special guest. Thank you.
Thank you so much, Dr. Schneider, for sharing all the wonderful things that you prepared for our guests. I had several favorite parts, and at first I thought my favorite part was going to be the social aspect, and then you brought up the federal laws, which are all important, and the co-occurring conditions are always important, and then stigma. So I am thinking we should probably partner together to start a stigma campaign. We have a lot of advocacy, etc., but what would that look like for us in Orange County? And we can maybe pilot it and then work with EAA on that. So let's put our thinking caps on about that. You seem very
I love
passionate.
that idea. I'm totally game. Let's do it.
Okay. And we're going to start right now because on this webinar, we have our teen and young adult coordinator as well as our children's program coordinator. And during November's program night, I'm going to ask them to talk to the teens and the children and the young adults about how they feel about epilepsy and if they feel that there's any stigma and what they can do, and then implement the suggestions you made. So we're going to get right on that. Okay, thank you again, Dr. Schneider. We appreciate everything you brought to this webinar. And for our next speaker, I'd love to introduce to you Colleen Gendris, parent of Owen, and she's an epilepsy advocate for epilepsy, and you can find her on Instagram at Raising Owen. You can follow her family's journey and meet Owen. Owen is one of our favorite youngest advocates, and we adore him entirely and his family. So thank you, Colleen, for joining us and providing a parent's perspective on advocacy in the school system.
Hi. Yeah. Wow. Thanks for that intro. I didn't know I was going to get some pictures of me and my prince here up on the screen. And thank you, Dr. Schneider. That was amazing. And I too am struggling to call chalk by its new name because that's where we've gone for care for 8 straight years. And the new name is a mouthful, but we are happy for that partnership. So, okay, I'm not going to take up a whole lot of your time. I am so excited to share about Owen's kind of educational experience because we generally had a positive one. So, I also want to say thanks again to everybody for being here. The best thing you can do for your kiddo is to be an informed and healthy caregiver. So, just by you guys being here and learning, bunch of green flags. So, good on you. Again, my name is Colleen Gendrius. I'm here in Orange County, California, and I am mom to Owen. He has Lennox-Gastaut syndrome epilepsy. So that is a rather severe form of epilepsy, and it's something we've been managing for years. So um, let's see, why did Owen need an IEP at school? That's fairly obvious, but numero uno was safety concerns for me, right? He was having a lot of active daily seizures at the time, but I wanted so badly for him to have a school experience. We know that epilepsy can take so much from your life already. And that was really important to us that he be in a safe environment at school. So, in addition to the seizures and that stuff, he also has a really fun habit of eloping whenever he sees an open door. So, again, safety was numero uno, and that sort of set the groundwork for getting an IEP going. And I want to say, you'll be out there researching, establishing an IEP for your kid, and it sounds like it's going to be this really contentious situation. And I was, of course, prepared for that. And I had been reading a ton about that before I went in to meet his education team when he was around 3 years old. And so, honestly, I just went into this meeting. I met with the whole special ed team there in our school district, and I was like a completely open book. I really had no idea how a school district was going to handle a kid like Owen. So honestly, I just put it all out there. I shared my concerns. I talked to them like two humans would talk to each other, sensitive, kindly, and really they were just super receptive. So I'm a big advocate for establishing an open and honest line of communication with your education team. I know Dr. Snyder, she mentioned that as well, and that is so important. So get that done. Just go in with an open mind and make friends. So with Owen, we did our seizure action plan. By the way, in Purple Ribbon World, you'll see that referred to as a SAP, SAP. That took me a minute to figure out, but that's what that is. He was also pretty quickly awarded an aid, a modified schedule, and all of his therapies integrated while he was there at school. So we got all the things we need. We got everything lined up. I felt great about having him there, and he's 8 years old now. He's in third grade, and he's just doing fantastic. So some kind of unique things we incorporated into his IEP was like Owen loves to sit in a wagon. So we got the school to agree to let him have a wagon in class. So he would sit there in his wagon and he was having just, that was so special of the school to do that for us. And I want to encourage you guys to ask for things, even if they sound kind of off the wall like that, because it worked out great and it helped my son so much. And all right, I'm not going to take up a whole lot more of your time, but like I said before, I just want to recommend that everybody focus on building a relationship with your child's education team, communicate often, and become friends. So, all right, that is it from Colleen, mother of Owen. Thank you.
Thank you, Colleen. We appreciate you being here, and we appreciate being such a valuable part of our community of support. And we really appreciate you sharing Owen with us. He's a very important part of our community of support too. I encourage everyone to follow Colleen and Owen on Instagram. They will certainly brighten your day. They are out there, they're in the community, they are living life large, and we love to see that. They always bring a smile to our face. So now it is time to introduce another one of our young advocates, but she's a little bit older than Owen, but she started advocating for us oh my gosh, about 5 or 6 years ago. And we adore her. I'd like to introduce Taylor Perez, and we are so grateful that she has taken the time to share her perspective and help our attendees better understand what it's like to be a student living with epilepsy. Um, we are so very proud of Taylor and her accomplishments and the positive impact that she has made and continues to make for our teen and young adults with epilepsy. So, Taylor, you're on.
Hi. All your presentations have been so good so far. Thank you for all the useful information. I guess I was just gonna kind of tell my story and then add some sort of like tips throughout the way. So, as you just heard, my name is Taylor Perez. I'm 24 years old, and I have epilepsy, but I had my first seizure in March of 2018 when I was 16, turning 17. So I was a junior in high school at the time. My first seizure did happen to be in health class at the time in front of all my peers. And that was not very fun, for me or them. And after I had that seizure in class, the school psychologist was brought in and talked with the students that were in the class with me, but the school psychologist did not talk with me. So I highly recommend if you or your child has a seizure in class, like in front of everyone, to maybe just have someone talk to them, because that's a lot for you to hold in, like, and just deal with on your own. And due to my epilepsy diagnosis and having that first seizure, I became very depressed and also suicidal, with a lot of suicidal thoughts and ideations. But I think that was also due because I was taking Keppra at the time, and eventually I had told my parents and my doctor, but it took about 2 months for me to open up and tell them. And when I did, my doctor and me, we decided to put me on Keppra extended release, because she told me that the extended release version of Keppra, um, all those side effects I was getting, depression, suicidal thoughts, etc., would go away with the extended release, but the effectiveness of the Keppra would still work. So I've been on Keppra extended release since about June of 2018. And so I've been on it for 7 years and it's still working good. Thank God. After my epilepsy diagnosis, my mom found the Epilepsy Support Network of Orange County, and she told me, hey, why don't you check this out? You're just diagnosed with epilepsy. There's all these, teens your age that also have epilepsy. At first, I was a little nervous going because I didn't really want to accept that I had epilepsy. But then I ended up going and I met a bunch of cool people my age, and they were able to relate to the things that I was relating to. Even though we all had different types of seizures, we all in the end have epilepsy. So it was really nice to have that kind of group to share with and just kind of relate to. And then I, so in 2021, in October of 2021, I stopped taking my medication. I was kind of just dealing with thinking, do I really have epilepsy? I haven't had a tonic-clonic or grand mal seizure since March of 2018. Like, do I really have it? I'm not having as many seizures, as some of my friends in the group. Like, do I really have it? So I stopped taking my medicine in October of October, maybe it was 2020. Anyway, I stopped taking my medication. I would only take one pill or no pills a night. And I did this secretly. I did not tell my parents or anyone that I was doing this. I was just not taking them. I highly recommend do not do that. It is very unsafe. Don't do it. I ended up having a breakthrough seizure in January of 2021. It was at my house, thankfully, in front of my parents though, and it lasted about 5 minutes or longer. So I could have, potentially, um, passed away from that seizure. But luckily I didn't. And ever since that night, I have been taking all my medication every single night that I'm supposed to, and I have not had any more tonic-clonic seizures. I still have, simple partial focal ones, but those are under control. But please do not stop taking your medication, no matter how much you want to, no matter how much the pills are hard to take, please take them. And, if maybe you or your child is struggling with depression or suicidal thoughts, like Dr. Schneider was saying, definitely look for mood changes in them, just these little changes that you're noticing. Check in on them because it could be very, severe and they just don't want to talk about it. Also, what I wanted to mention is I would really hope that your child is taking their medication, but if they're like me and secretly not taking it, something that my mom did that, I might recommend is counting your child's pills to make sure that they are taking them all. And, I kind of hid mine, so my mom didn't notice a difference, but I would still recommend checking, are they taking them? And also, so because I had the seizure in high school, and I felt like I was older, had a relationship with my teachers, I told them about my epilepsy, and then I would send them an email with the steps of what to do. And then because a lot of, well, the schools in our district, they don't do seizure first aid training for all the teachers. It's an optional thing. And so most of them don't even know what epilepsy is. They don't know what to do when somebody has a seizure. So I always tell them. And then in college, I would go through what's called the disability support services, and I would get accommodations like longer test times in case I had a seizure. Maybe turning in late assignments, in case I had a seizure. And then I would also email all of my professors, hey, I have epilepsy. This is what to do if I or maybe a future student in your class ever has a seizure. And so now you would know what to do. And I recommend telling, whoever you're with, whether it's a friend, maybe you're just made a friend, like a stranger, or your teachers, always tell them that you have epilepsy. It's most likely going to feel awkward at first. Sometimes I still get a little like nervous telling people I have epilepsy, I might have a seizure. It does get nerve-wracking still at times, but it's best to do for your health and your safety. So that's me. So yeah,
I just wanted to say, Taylor, thank you so much for sharing your story. It can be hard to tell your story publicly like this, and I just think you're courageous for sharing. And
thank you.
so many people struggle with taking medications. It's like
Yes.
every other patient that I see has challenges with this, and so that's not
Mhm.
a unique to Taylor thing. There's probably people on this call who have had children that struggle with it or struggle with it themselves. And so talk to your doctor because there are things we can do too to help with that. And so definitely, wow, what an amazing story. Thank you for sharing.
Of course.
Thank you, Taylor, for sharing that. And Taylor has been an inspirational leader in our teen club and young adult, and she shared her story about not taking her medication with our teens. And it really made an impression on the teens and young adults. And several of them said that they were thinking about not taking their medication or stopping it to secretly see if they still had epilepsy. And they all decided that that wasn't a good idea because one of their peers told them. So the parents had been telling them, teen coordinator telling them, all of us telling them, doctors telling them, but they listened to Taylor and she made an important difference. So Taylor, we adore you. Thank you for
Of
always being there for us and for your peers and
course.
being that source of light and inspiration. And uh, she's been our one of our advocates for years, and we thank you for being here tonight. And I think there'll always be another time, Taylor, that we will call you for advocacy. So,
Anytime. I love advocating for epilepsy and helping others. So, yes.
and that's what we love about you, Taylor. You're great.
Thank you.
And thank you to your mom, Andrea, too, who is one of our major advocates and behind the scenes getting everything done for us as well. So, okay, so you heard from our speakers, and now we'd like to open the webinar for a Q&A with our dedicated speaker. So I think Cassie wants everyone to type their questions in the chat, and I'm going to turn this over to Cassie Corral, and she's going to facilitate the Q&A and also get us started on our closing remarks.
Yes, I want to just say thank you to everybody for sharing tonight. Dr. Schneider, your presentation was so informative. I loved that you also touched on not just the clinical aspects of epilepsy, but the social stigma, the social isolation, some of the mental health challenges that can often accompany an epilepsy diagnosis. I think that those are just as important, especially when we're considering things for back to school and what to be on the lookout for with those of us who may have school-age children. Or even children that are a little bit older that are young adults and in the college age, such as Taylor. So I'm so glad that you addressed that. And I loved that we also got to hear from a parent and patient perspective. I appreciate both of you for sharing your stories. I know that with Lennox-Gastaut syndrome, I'm sure that you have had no shortage of opportunities to advocate for your son, Colleen. So I know that your advocacy has probably encouraged lots of other parents on their advocacy journey, because it can feel like an endless battle at times. So I appreciate your story. And Taylor, you are so courageous with your story as well. I have a son who is turning 18 soon who has epilepsy. So he has been on medication for a long time. And you know, I can appreciate you encouraging other people your age or around your age, or who have had to take up medicine for a long time, that it can get frustrating to take that medication, and your encouragement is really going to help a lot of people. So I appreciate you sharing that. Thank you to everybody for being here this evening. If there are any questions, now would be a great time to post them in the chat. I do want to just address that this has been recorded and we will be sharing this afterwards. So if anyone came in late, or if anyone would like to be able to reference back to any of the information that was given tonight, you will be able to do that on Epilepsy Alliance America's website, which I did put the link to that in the chat. We have a webinar library. So all of our past webinars are posted there, and that's where this one will live once we get the recording downloaded and get it prepared to upload there. But while you're there, you can also browse some of the other topics that we have there. One of the questions that's in the chat is asking about elementary students riding the school bus with or without a nurse. And if they are riding the school bus, what could happen if a child were to happen to have a seizure on the school bus, which is a really great question, a really relevant topic to discuss. I could have some things to say about it, but I will turn it over to our panelists. And then if I need to chime in with any of our resources, I'm happy to do so as well.
Happy to take a stab at this one first.
Yes, please do.
So epilepsy has a huge range. There are kids who have really severe seizures that are life-threatening, and there are kids who have seizures that are brief staring spells and are less concerning. So I would say talk with your healthcare team about what type of seizure and how concerned you would be about that particular type of seizure happening on a school bus to make that decision. But definitely having a prolonged seizure on a school bus, but it could be a pretty scary situation. So it's all about risk benefit and talking about your child's individual situation with your healthcare team.
We can address that at ESNOC. We provide seizure recognition and first aid training to school bus drivers and school bus aides. And many of the school districts will have a bus aide for the students that have active seizures or the longer seizures like the tonic-clonic seizures and need additional help. So that's something you can address in your IEP. And please connect with your local advocacy organization or EAA And if you're in Orange County or Southern California, we're happy to do presentations for the bus drivers and the bus aides at no cost at their schedule and their location, to keep your children safe.
Agreed. Great answers. And just want to also mention that the on-demand training that Epilepsy Alliance America has on our website, which is free to take and available around the clock, also does address seizures on a school bus. So that would be an option as well. So I hope that answered your question and provided you with some resources, Natalia. Jana, your comment about how do you find an epilepsy center? I know one way I will just mention is that we do have a page on Epilepsy Alliance America's website that directs to the National Association of Epilepsy Centers, and it does list all of the level 4 epilepsy centers in the US. So if you are wondering if you have one near you, that's a great resource for finding that out. Or again, if you have an advocacy group that is local to you, that is probably a connection that they can help you make as well. And then our friend Kylie would like to ask for any advice on how to keep up with schoolwork, which I know can be definitely a challenge. And Taylor, you had some great suggestions there about talking with the teachers, asking for some accommodations, making sure the teachers are aware of any potential side effects that the student may be from their seizures or from their seizure medication, such as sleepiness down, which I think all of these are really great tips, and really go back to the topic that has come up a couple different times this evening about building those self-advocacy skills, which, you know, Kylie is on the younger side, but will continue to learn as she gets older. And then also probably could be addressed with the student's IEP or 504 plan. That way, student, parents, teachers are all on the same page with that. Any other comments that regarding Kylie's question about schoolwork?
I would just emphasize sleep is so important. And so talking with your teachers about balancing that, sleep deprivation can be a provoking factor for seizures. And so if a child is staying up late to try to get all their homework done, they're going to end up missing class, and it's this vicious cycle. So it's all connected. And so, you know, making sure you prioritize sleep over doing lots and lots and lots of homework late into the night.
Very true. That's a great tip. Oh, I'm having an issue with my chat here. Sorry, everybody. There we go. Ruby is asking about getting epilepsy network at their schools. Ruby, I'm not sure if you're local to California, but if so, I will let Jana speak to how you can connect with ESNOC and utilize their services.
Thank you, Ruby. You can just give us an email, and we are happy to come to your school and do seizure recognition and first aid and any sensitivity training that you may need.
Great. And then I think the last one that we're going to address is Natalia also had a question about when a child has many seizures a day and has a hard time being at school, has a difficult time with attendance. And I think that goes back to some of the other topics that we've discussed as far as communication, accommodations, 504 and IEP plans. But any other last tips for just having clear, open, and transparent communication between the parent or the student and the school that
I would
anybody
say
would
if
like
the
to
child
share?
is having, you know, so many seizures a day, make sure you're talking with your epilepsy team and see if we can get that, you know, under different control, so that they can get to school, because that's our goal. We want these kids to develop and grow, and, you know, take medicines that support that. If that's not feasible, there are home hospital programs, and there are programs to have education continue at home. And so it's something to talk with your team about as well.
Yeah, I can touch on that a little bit too, since we had many, many years of that lived experience. But for us, what helped a lot was having a modified schedule in place. That really helps address like any attendance issues because we actually had a doctor's note letting the school know that when Owen has increased seizures or has a really bad day, he's not going to make it to school. And we've had years where that is happening a lot. Also, when he was at school, we got the school to agree to like a safe place for him to recover as well. So my guy would have like a lot of short seizures. And so sometimes he would just, need to lay down for a minute or two and then just be right back up afterwards. So, it really depends on your kiddo's specific type of seizures that they're experiencing. But yeah, for somebody like my guy with a lot of daily seizures, having a modified schedule in place was really allowed maximum flexibility, and in the end allowed for a better attendance record, because then we would be allowed to go to school in between tough parts of the day.
I think that's a great tip, Colleen. And it helps your student learn that, advocating for themselves or being a beneficiary of their caregiver's advocacy really allows them to play to their strengths, right? If the school is willing to accommodate a modified schedule and that they struggle in the mornings, or that tends to be where they have, more frequent seizures, or vice versa later in the day, really allowing them to utilize the best hours of their day in the best way possible benefits everybody. So thank you for sharing.
Exactly.
All right, well, I think